Hi, this is Lanil Mitchell from Revolution Physical Therapy in Cranberry Township, PA. Today I'm here to talk about a serious subject, and as we're approaching the summertime, it's going to give people the opportunity to hopefully do something to prevent these injuries. The one we're talking about here is female athletes that play running and cutting sports, jumping sports such as volleyball and soccer. And the injury that we're talking about is ACL tears. Why'd you look at me like that?
Nothing.
Okay. The writing's kind of on the wall with these injuries. Women are tearing their ACLs in sports like that, like we just mentioned, up to 10 times as much as boys tear their ACLs. And I was really fortunate to find this out when I went to Cincinnati. And actually I always tell people this, that Cincinnati is one of the biggest places in the country for sports medicine research, especially for female athletes and their ACL tears. At the Children's Hospital, they have one of those big 3D motion analysis labs where they bring the kids in and test their biomechanics and all the force jumping plates and everything that they have, that they can measure people's forces when they're landing and stopping and cutting and jumping. And they use that information to, number one, they figured out that the number one issue with ACL tears, especially non-contact, the difference being that a player gets tackled or something like that, that's a contact injury. But a non-contact injury is when you're just running along and you go to cut and plant, or you land from a jump and poof, the knee gives out. Now it does happen to boys, but it's a lot less often. I think it's close to 80% of girls' ACL injuries are non-contact in nature. And so they've been able to determine with that research that actually the way that women are landing and pivoting and cutting is simply it's a biomechanical problem that allows their ACL to get into a position where it gets injured. It's simple. So the simple solution to that is that you fix their biomechanics, and biomechanics and our control of our biomechanics and coordination and improving our coordination doesn't necessarily come from increasing our strength. You have to teach appropriate movements. They have to learn how to squat appropriately with the appropriate firing mechanics, or the appropriate timing and firing of their muscles. They have to learn how to absorb impact and land, and what place they should put their foot underneath of their center of gravity. And then they have to do it over and over and over and over again, so when they're not paying attention to it in a basketball game, you can't think about the way that you're getting ready to land when you're going up to rebound a ball. And so when you're coming down, you have to have had that motion pattern inside of your body thousands and thousands and thousands of times. And that's why we need to really start looking at girls' sports a lot differently. When a girl's 13 and she hits puberty, she needs to be, especially if she's playing volleyball, soccer, or basketball, she needs to start doing some kind of training program that's going to get her used to controlling her body and landing and absorbing impact when they cut and pivot and putting their hips in the right position.